A new report shows the number of suicides in South Carolina is growing.
So we wanted to take a closer look at the resources available in our community and speak to those working to make a difference.
Our reporter Renee Wunderlich spoke with those personally impacted by suicide to hear how they're looking to get help for others. She's live tonight in Greenville with more. Renee.
Well, Nigel, Carol, we're right outside the Phoenix Center here in Greenville. This is a place where folks are helping others in recovery from drug and alcohol addiction. Now, inside, I also spoke to someone about his family's personal experience with suicide. This is his message.
Our mental health is just as important as our physical health.
Dennis Gillen speaks openly about suicide because his family knows the impact of it way too well.
We buried Mark in 1983, and I thought I was out of the woods. One of 5 kids, and 11 years later, the phone rang again, and in a drunken stupor with access to lethal means, I lost my younger brother Matthew to suicide.
A nationwide health report recently released by the private foundation Commonwealth Fund shows more South Carolinians are dying from drugs, alcohol, and suicide. Their study shows that between 2013 and 2017, per 100,000 people, drug deaths went up 13 to 20.5. Alcohol-related fatalities increased 7.4 to 10.5, and the number of suicide deaths went up from 14 to 16.3. Now some in the upstate are working to get those numbers down.
So at every Bon Secours facility, we screen for both depression and suicide because we know that 45% of patients who die by suicide saw their provider in the last 30 days. So we're encouraging that conversation.
Psychiatrist Carson Felkel says those with depression or anxiety can often struggle with substance use disorders. Bon Secours St. Francis Health System partners with community organizations like the Phoenix Center that provide a variety of recovery resources for folks of all ages and incomes.
We provide services to the whole community without reference to insurance or ability to pay. Our doors are open to everyone who needs it.
These are resources that Gillen says can be life-saving, and he wants others to do what he wishes his brothers had done. Ask for help.
People love to help. We just have to know. My brothers never asked me for help. I would have in a heartbeat. You can hear my voice cracking. I would have done it in a heartbeat. I would have helped those guys. But they never raised their hand and said, hey, I'm not doing so hot.
Now, if you or someone you care about may be in crisis or just needs to talk to someone about their own mental health, we have a list of resources, phone numbers, and links for you on our website, WYFF4.com. Live in Greenville tonight, Renee Wunderlich, WYFF News 4.